Hi. So how did the exam go on Sunday? Hopefully it went well and you have got most of your questions correct. All the best for your results, and let's discuss some of the questions that were asked from anatomy. There were about 10 questions which most of you have sent, that these were the questions that were asked in the INICET exam. So I have taken these 10 questions and we'll try to discuss these 10 questions in the next few minutes. So let's begin with the first question. It's always heartening to see the questions from embryology. Most of us would have neglected embryology during our first year MBBS, but we would pick it up especially for our entrance exam because embryology, neuroanatomy, and head and neck topics are very frequently asked. So this question was from the topic of spermatogenesis, the embryology topic, and the question was, where is the mitochondria located in the sperm? Right? So the process of spermiogenesis causes differential organization of the cell organelles of spermatozoa, right? So spermatid, as it becomes converted to elongated spermatozoa, these morphological changes will appear. So when we talk about the parts of a spermatozoa, if we see this image, this basically summarizes the structure of spermatozoa. The mature spermatozoa roughly measures about 50 microns in length. And the parts include, it has got a head, right? That's the head of the spermatozoa. Then there is a neck region, and then it has got a tail, right? So these are the three main parts. The head measures about 3 to 4 microns. The neck measures about 0.3 microns. So this is actually the smallest part. Then the entire tail roughly measures about 40 to 45 microns, out of which the tail is divided into three parts. The first, or the initial part, is called as mid piece or middle piece. Then there is something called as principal piece, and then there is the terminal piece. Tail is responsible for motility, and in that the principal piece is responsible for motility. So remember this is responsible for motility of the spermatozoa. Then the middle piece has the mitochondrial sheath covering the axoneme, right? So this was the question that was asked in the recent INI-CET exam. So which part of the spermatozoa has mitochondria or mitochondrial sheath? So remember, the answer is the middle piece. Okay, so this is the ultrastructure of the spermatozoa at the tail, right? Showing the organization of the central pair and then the surrounding 9 arms of microtubules, right? And this in turn is covered by the sheath of mitochondria. Okay, so the correct option here is the middle piece. So most of us would have tempted to attempt the principal piece as the correct option because of the name itself, right? Even though it's called the principal piece, its major function is motility, whereas the middle piece is the powerhouse of the spermatozoa. And how it can become powerhouse? Because of the plenty of mitochondria located inside it. So this was the first question asked from spermatogenesis. Apart from this, you can also get questions in your next INI-CET exam or the NEET PG entrance exam on the different steps of spermatozoa. So gametogenesis is one topic that you must never skip. Let's move on to the next question. The next question was also from the gametogenesis, and this was from oogenesis. Okay, so the question read like this: at birth, right, in which stage of cell division is the primary oocyte arrested? Now remember, in our video lectures we have discussed extensively about this, right? So every time there is a question on oogenesis, it is about when exactly the cell division gets arrested, when exactly the cell division gets completed. Okay, remember, when we talk about the steps of oogenesis, right? So what do we have? We have oogonia, right? Now these oogonia will give rise to what we call as primary oocytes, right? So the primary oocytes. Now apart from primary oocyte, there is also formation of a structure called as polar body. Right. Now these primary oocytes will further undergo subdivision, giving rise to the secondary oocyte and the second polar body, whereas even this will undergo subdivision, giving rise to polar bodies. So at the end of oogenesis, we have about 3 polar bodies and then 1 secondary oocyte. Right. Now remember, all the oogonia get connected or get converted into primary oocyte before birth. Okay. So by about 3rd month or 5th month of intrauterine life, all oogonia are converted to primary oocytes by a process of mitosis. Then the primary oocytes undergo the stage of meiosis. Now, as we know, meiosis is divided into meiosis 1 and meiosis 2. Right? Now, in meiosis 1, right, there is a stage called as prophase 1. Right? So, the arrest of primary oocyte occurs in prophase 1 of meiosis 1. Right. Now, what exactly happens in prophase 1 is these has different subphases like leptotene. Right. So, we have leptotene, then we have zygotene. So, in case of leptotene, the chromosome condense and appear as paired chromosomes. In zygotene, there is formation of tetrads, and then there is a stage of pachytene where there is fusion, and then there is a stage called as diplotene. Right? Now, diplotene is the last stage of prophase 1. What happens in oogenesis is most of the primary oocytes will get arrested in the stage of diplotene. So this prolonged phase of, remember, this prolonged phase of arrest of primary oocyte in prophase 1 is also known as dictotene. Right? This is the correct option here, dictotene. Right? Even though you might be tempted to mark diplotene. Diplotene is the normal meiotic division, or it's a subphase of prophase 1. But in oogenesis, this diplotene gets arrested for a prolonged period of time unless this division is completed. So this stage of prolonged arrest is what we call as dictotene stage. Right? So most of you might have picked this, but the best option here is the dictotene. Okay, so this is regarding one question which was asked. Now, this is the stage at which primary oocyte will get arrested, right? Prophase 1, okay, of meiosis 1. Now, when exactly this is completed? So remember, this division or prophase 1 is completed just before ovulation. Okay, so the first cycle of oogenesis will last for about 12 to 14 years. Right? So the first cycle itself. Okay. Now, the just before ovulation, this prophase 1 is completed. Right? So the secondary oocyte enters into the second meiotic division only to get arrested again. Right? But here the arrest occurs in metaphase. Okay. Now remember, so secondary oocyte will get arrested in metaphase. Now, when exactly this cell division is complete? This is complete only after the entry of spermatozoa or fertilization. So these are the 4 stages you must remember. So all primary oocytes are formed by about 5th month, all of which will enter into meiosis 1 only to get arrested in prophase, and in particular the dictotene stage visits the prolonged diplotene stage where the oocyte is arrested in cell division. Now this meiosis 1 is complete just before ovulation at the onset of puberty. The secondary oocyte enters into the second meiotic division, which again gets arrested in metaphase 2, and this gets completed only after the entry of spermatozoa. Right? So the correct option here is the dictotene stage. Right? Done. These two were the questions from the gametogenesis topic. Right? Then there was one more question from embryology itself, and this question was about the neural crest cells. So the question was, which is not, okay, so which is not a derivative of neural crest cell. Okay, so let's go back and try to learn a little bit about neural crest cell. Now remember, we have three definitive germ layers, right? So what are they? The first one is the ectoderm, then we have the middle mesoderm, and innermost layer that we have is the endoderm, right? The ectoderm is further subdivided into two. One is surface ectoderm and the other one is neurectoderm. The neurectoderm is the central part of the ectoderm. This neurectoderm undergoes invagination. Now this invagination is what is called as neural groove. Right. Now, as the neural groove deepens, we have the formation of what we call as neural folds. So these are neural folds. Now, what exactly are neural crest cells? Remember, the tips of the neural folds, right? The tips of the neural folds become specialized or modified, and these are called as neural crest cells. Okay. What happens in further development is the like cells fuse, giving rise to formation of a rounded neural tube. Then the folds of the neural tube will close, forming a separate set of neural crest cells. Then the surface ectoderm will close the defect. Okay, so this is how the process of neurulation is complete. So your neural crest cell is basically a derivative of ectoderm or neurectoderm. So once further differentiation continues, neural crest cells come to lie on either side of neural tube, giving rise to various structures. Now, what are the most important structures that develop from the neural crest cells? Remember, first thing you can think of is the leptomeninges, right? So the leptomeninges like pia and arachnoid are derived from neural crest cell. Then you have the development of the sensory ganglion, right, the dorsal root ganglion, then the cranial parasympathetic ganglion. Okay, so when we talk about cranial parasympathetic ganglion, what are the four cranial parasympathetic ganglion we have? Remember, we have the otic ganglion, then we have the submandibular ganglion, then we have the ciliary ganglion, and then we have the pterygopalatine ganglion. So all these cranial parasympathetic ganglions are developed from the neural crest cells. Okay, apart from this, if you remember the entire mesenchyme of the head and neck region, for example, the mesenchyme of the pharyngeal arches, including all the osseous elements, are derived from the neural crest cells. Apart from this, you can think of melanocytes, right? So melanocytes are one more important structures derived from neural crest cells. Now, apart from melanocytes, you have the adrenal medulla. Now, remember, this again is a favorite topic of your examiner. Let it be your entrance exam or your university exam. Okay. So the development of adrenal medulla is very peculiar because the outer or the peripheral cortex develops from mesoderm, whereas the inner medulla develops from the neural crest cell. Sometimes this question has been phrased like this. Okay. Now, which of the following pair of structures have the same origin? So they would combine two structures developed from neural crest cell, and they will ask you to identify which of the following pairs of structures develop from the same embryological origin, right? These questions have been previously asked both in your INI-CET as well as the NEET PG entrance exam. So derivatives of all the germ layers, ectoderm, endoderm, mesoderm, then the neural crest cell is a must-know topic and a high-yielding topic. Now let's try to solve the question. So the question was, which of the following structures is not a derivative of the neural crest cells? So as we said, melanocyte is an important derivative of the neural crest cell, right? So this we agree. Then apart from this, we said cranial parasympathetic ganglion. Then the ciliaris muscle is also a derivative of the neural crest cell. When we talk about the retinal pigment epithelium, remember, this is a derivative of the ectoderm and it is not a derivative of neural crest cell. Even though neural crest cell itself is a derivative of ectoderm. Remember, retinal pigmental epithelium is not a direct derivative of neural crest cell. That is how the correct option here should be the retinal pigment epithelium. Okay, one more peculiarity of retinal pigment, this is considered as a part of your central nervous system. Remember, when we call the parts of the central nervous system, the first part is the brain, then we have the spinal cord, then we have the retina, and then we have the optic nerve. So all these are considered as part of the central nervous system. Right? So this is regarding the neural crest cells. So what is the must know topic here? The derivatives of all the germ layers. Right. Then let's move on to the next question. Now again, cranial nerves, the foramen of the skull, attachment of the cranial nerves to the base of the brain or inferior surface of the brain. We have seen plenty of questions year and year again on this topic. Right. So this was what the student said. This probably was the image, and they are asked to identify the pointed nerve. So remember, this is the interior of the cranial cavity. Okay, so what we have here is, this is the anterior cranial fossa, right? So let's mark it. So we have the anterior cranial fossa, and this is the middle cranial fossa, and this is the region of sella turcica, where the center is depressed and called as the pituitary fossa or the hypophyseal fossa, where we have the pituitary gland located. Now, what we can see here are few nerves emerging. Okay, so what we have here, this is the first cranial nerve or the olfactory nerve. Okay, then the second cranial nerve, this is the optic nerve. Okay, so here is the optic nerve, and then you also have the ophthalmic artery, right? Then there is one thick nerve, right? Now this is the nerve that was pointed. So what could be this important nerve? So remember, this is your third cranial nerve or oculomotor nerve, right? Then you can identify a slender nerve here. This is the trochlear nerve, and then below you will see one more small nerve, and this could be your abducent nerve. Remember, the trigeminal nerve divides into three branches. These are ophthalmic, maxillary and mandibular, and ophthalmic division will enter through the superior orbital fissure, maxillary nerve will enter through the foramen rotundum, and mandibular nerve will leave the skull through foramen ovale. So let's try to take a look at these images. So what is the correct answer here? It is oculomotor nerve. And remember, this is one more important nerve that is very frequently asked. If you remember, there was one question related to oculomotor nerve in the previous INI-CET which was conducted in May. Right? So oculomotor nerve, the cranial nerves as they exit the skull, the cranial nerves as they attach to base of the brain, all these are like must know topics. Now, here if you observe, this is the picture of the cranial cavity. Now let's take a quick look at how each cranial nerve will pass through different foramina of the skull, right? So remember, this is the cribriform plate of ethmoid where we have the passage of the olfactory nerve. The optic nerve passes through this optic canal. Okay, so this is the optic nerve. Now, then we have oculomotor nerve, trochlear nerve, abducens nerve. All these nerves will pass under a retort-shaped fissure which is present here. And what is this? Superior orbital fissure present underneath the lesser wing of sphenoid, right? Now, here what cranial nerves pass? The third, then we have the fourth or the trochlear nerve, and then the sixth cranial nerve. Apart from this, also remember, it gives passage for the nasociliary division, right? The nasociliary division of the ophthalmic branch of the trigeminal nerve. Okay, apart from nasociliary, we also have the lacrimal nerve and the frontal nerve. So basically, it gives passage for the ophthalmic division of the trigeminal nerve, whereas maxillary passes through foramen rotundum. Now, where exactly is foramen rotundum? This is the foramen rotundum, and here we have the passage of the maxillary nerve. Right behind us, we have the foramen ovale, and here passes mandibular nerve. So this is how trigeminal nerve gives 3 divisions and they pass through different foramina. Then what about the next few cranial nerves? The next cranial nerve we have is the 7th cranial nerve. Remember, this is the region of the internal acoustic meatus. Okay, so this is internal acoustic meatus. Through the internal acoustic meatus, we have the passage of the 7th or the facial nerve, 7th cranial nerve or the facial nerve, and then we also have the passage of the 8th cranial nerve or the vestibulocochlear nerve. Right? Remember, vestibulocochlear nerve is a sensory cranial nerve, so it enters through the internal acoustic meatus and gets attached to pontomedullary junction. Whereas the facial nerve enters through the internal acoustic meatus, passes through the middle ear and leaves the skull through the stylomastoid foramen. Okay, stylomastoid foramen. Now again, this is one more important question they might ask you very frequently. How facial nerve exits the skull? It enters through internal acoustic meatus to enter the middle ear and then leave the skull through stylomastoid foramen. Then what about the 9th, 10th and 11th cranial nerve? Remember, the 9th, 10th and 11th cranial nerve are present in the jugular foramen. Okay, now jugular foramen will allow for the passage of 9th, 10th and 11th cranial nerve. Then the last of the cranial nerve passes through the hypoglossal canal. So here passes your 12th cranial nerve or the hypoglossal nerve. So knowing the foramina of the skull and through what foramina each cranial nerve either enters the skull or exits the skull is a high yielding and a must know topic. Right? Done. Then now this is one more question that is very frequently asked, so you should never miss such questions which are repeated often. Okay, so this question was on Tyon, one of the important landmark in your skull region, which we learn day and night. Right? So what was the question? Which of the following structures is present beneath the marked area? And as we can see, the marked area is Tyon. So what is Tyon? Tyon is, as we can see here, it is a H-shaped suture formed by the junction of the frontal bone, parietal bone, temporal bone and the greater wing of sphenoid. So this is called as Tyon. Right? Now Tyon is located behind your lateral orbital margin, but what is important for us is to know the relation of the Tyon. Remember, the Tyon is related to two important structures. One is the middle meningeal artery. Okay, now remember, middle meningeal artery is one of the branches coming from the first part of maxillary artery, and apart from this, the next important content is the Sylvian point. Right? Now what exactly is Sylvian point? If you remember the outline of the superolateral surface of the brain, right? So we have the central sulcus and then we have one of the most important sulcus, and let's say this is that posterior ramus of lateral sulcus. Lateral sulcus begins from the inferior surface of the brain, and when it cuts the superolateral surface, at a point it gives rise to three important rami. So this is called as anterior horizontal, then we have anterior ascending, and this is called as posterior ramus. Okay, all are the small branches coming from lateral sulcus, and this region where the stem of the lateral sulcus splits into three rami, this is what we call as Sylvian point. Okay, now just in front of this area, in front of the Sylvian point, this is the area where we have the Broca's motor area, but that is not represented by your Tyon. And then close to the posterior ramus of the lateral sulcus, we have the vernix area, right, which is the sensory speech area. Okay, so other important thing you must know here is the middle meningeal artery is the source for extradural hemorrhage. At this point, can you tell me what is the source of hemorrhage in subdural hemorrhage? It is the cerebral veins. What is the source of bleed in case of subarachnoid hemorrhage? Remember, it is the cerebral arteries. Again, these questions are often repeated. The source of bleed in case of extradural, subdural and subarachnoid hemorrhage. So extradural, it is the middle meningeal, subdural cerebral veins, and subarachnoid, it is the cerebral arteries. So let's try and solve this question now. So which of the following structure is present deep? Axillary meningeal artery, wrong again. This is also one of the branches of first part of maxillary artery. Stem of the lateral sulcus, we will station it. Broca's area and Wernicke's area are not the exact option because they do not correlate with the location of Tyon, right? So the correct option or the most appropriate option is the stem of the lateral sulcus, which should be ideally written as the Sylvian point, right? So this was one question which was related to Tyon. So Tyon has a lot of clinical importance because of its relation to these two structures, right? Then let's move on to the next question. So the next question again is a question which was not directly asked like this, but this was asked also in your previous INI-CET exam in May 2024. There was one question related to the constrictor of pharynx, right? So this was basically a case-based question and the case itself had the clue, right? So let's pick up those clues. Now there is progressive difficulty in swallowing or there is dysphagia and there is regurgitation of undigested food and sensation of food getting stuck in the throat. Then there is report of bad breath and episodes of coughing, especially at night, right? So all these point towards a diverticulum which is basically compressing on the pharynx as well as causing regurgitation of food resulting in bad breath or foul smelling breath and then possibly even vomiting. Then on physical examination there is a palpable neck mass which increases after eating, again stating or reiterating the fact that this could be a diverticulum. Then an X-ray and possibly an X-ray image was given with this which shows pouch-like outpouching, especially when the barium meal is given, and this is in the posterior pharyngeal wall. This may not be the exact case, but this is how possibly it must have been given, right? And then what is the most likely diagnosis? So most of us have already made the diagnosis, but let's see, this was the image that was given, right? So this is a diverticulum coming from the posterior pharyngeal wall resulting in bad breath, regurgitation of food, cough and pressure symptoms. So what this could be? This could be the Zenker's diverticulum. Now what exactly is Zenker's diverticulum and how this is caused? Remember, the spaces between the constrictors of the pharynx. The muscles of the pharynx are arranged in two layers, constrictors and longitudinal muscles. So these constrictors are, so first we have the superior constrictor, then we have the middle constrictor, and then we have the inferior constrictor which is divided into thyropharyngeus and cricopharyngeus. Right, the space between the base of the skull and the superior constrictor, this allows for the passage of four important structure. So one is the pharyngotympanic tube or the auditory tube, right? Then it allows for the passage of ascending palatine artery, then pharyngeal branch of ascending pharyngeal artery, and then levator velar palatini, one of the muscle of your palate. These are the four structures that passes in the space between the base of the skull and the superior constrictor. And this space is also called as what? The sinus of Morgagni. Right? So this is called as sinus of Morgagni. Then the space between the superior constrictor and the middle constrictor, here passes the stylopharyngeus muscle. Okay, one. Accompanying this is your glossopharyngeal nerve or the ninth cranial nerve. Then between the middle constrictor and the inferior constrictor, in this space we have the passage of the superior laryngeal nerve, right, or superior laryngeal vessels and internal laryngeal nerve. Then the space beneath the inferior constrictor, we have the passage of the inferior laryngeal nerve, and then apart from this we have inferior laryngeal vessels and recurrent laryngeal nerve. So structures passing between the constrictors is one of the favorite topics of your examiners or paper setters. But what was asked here was Zenker's diverticulum. Now where did Zenker's diverticulum come from? Remember, the thyropharyngeus and the cricopharyngeus will have a gap in between. This gap is also called as Killian's dehiscence. Okay, so this is called as Killian's dehiscence. The peculiarity of the inferior constrictor is when the thyropharyngeus contracts, cricopharyngeus relaxes, so that food goes in. When thyropharyngeus relaxes, cricopharyngeus constricts, preventing the entry of food. So basically, thyropharyngeus and cricopharyngeus are almost opposite in action, and this is responsible because of the neuromuscular coordination. When this is lost, what happens is both of them either contract together or relax together. So this causes increase in pressure within the lumen of the pharynx, causing the mucosa to pouch outside or evaginate. The evaginated mucosal pouch through the Killian's dehiscence is what we call as Zenker's diverticulum. So whenever food is eaten, the food gets accumulated here, resulting in regurgitation. When the person affected with this diverticulum tries to sleep, there is foul smelling breath, even there could be vomiting because of the regurgitation. So X-ray will reveal on barium meal outpouching predominantly in the posterior pharyngeal wall where we have the Killian's dehiscence. So what is the correct option here? It is the Zenker's diverticulum. Right? Done. Next, we had a question related to the head and neck region. So this was related to facial palsy. But more than facial palsy, the question was about checking your knowledge of the functions of different muscles of the face. Remember, when we learn about muscles of the face, we must learn about three important muscles attachments. So these are orbicularis oculi, orbicularis oris, and buccinator. Rest of the muscles, even if you know the action, it is fine. So let's read the question. A 29-year-old patient, after recovering from right-sided facial nerve palsy, reports that the foot frequently gets trapped between the teeth and the cheek. Okay, now remember, normally in all of us, there is a muscle which is helping to prevent the accumulation of food in the vestibule and also the space between the teeth and the gums. Right? So in facial palsy, this is affected. So which muscle weakness is responsible for it? So what the examiner is trying to assess is, indirectly he is trying to check whether you know the functions or actions of each of the muscles of the face. Right. Now, orbicularis oris. Orbicularis oris is also called as the kissing muscle because it is used in doing kissing or pouting. Right. This is the function of orbicularis oris. So it's basically a sphincter of your oral cavity. Then the zygomatic muscle, the major and minor muscle, are involved in expression of smiling and sadness. Then orbicularis oculi. When orbicularis oculi contracts, there are multiple functions. Remember, there is orbital part, there is palpebral part, and there is lacrimal part. When the orbital part closes, it results in forceful closure of the eyelids. When palpebral part contracts, it results in gentle closure of eyelids as in blinking. Whereas when the lacrimal part contracts, it results in improved flow of the drainage of tears. Right? So buccinator muscle, also called as trumpeter's muscle, is used for blowing air into wind instruments. Right? That is why it's called as trumpeter's muscle. Now, apart from blowing air, the other important function of buccinator is this prevents the accumulation of food between your cheek and the teeth. This is the primary function of buccinator. So the correct option here is the buccinator muscle. Done? Right. The next question which we can see was from one of the peritoneal folds, right, related to stomach or spleen. Now let's read the question. During a splenectomy procedure, bleeding occurs while cutting a structure that connects spleen and the stomach. So what structure is cut? Gastrosplenic ligament. Ligament connecting stomach and spleen. What is that? Gastrosplenic ligament. So which artery is responsible for this bleeding? So basically, the examiner is trying to check whether you know about what are the ligaments that are attached to the hilum of the spleen and what structures are present within these ligaments. Remember, in order to understand this, let's see the transverse section of the abdomen where we have the peritoneal folds orientation. So what we have here is the stomach, this is the stomach, and here is the spleen, right? So there is a ligament connecting stomach and spleen. This is the gastrosplenic ligament. Then if you see there is a ligament connecting the kidney and the spleen, this is called as the lieno-renal ligament. Now these two ligaments are important because they are connected to the hilum of the spleen. Not only that, within each fold you have two different blood vessels. For example, passing through the gastrosplenic ligament, we have the short gastric artery. Right? Short gastric artery, whereas lieno-renal ligament will contain the splenic artery. Right? So what was the question? The question was, which artery results in bleeding if a ligament connecting the stomach and the spleen is cut? So if gastrosplenic ligament is cut, which ligament is most likely to be injured? It is the short gastric artery. Remember, the left gastric artery is present close to the lesser curvature of the stomach, whereas gastroepiploic arteries are present along the greater curvature of the stomach. Splenic artery is one of the important posterior relations of the stomach, and it forms one of the important structures of the stomach bed. Short gastric arteries are in turn one of the branches coming from the splenic artery, and these supply the spleen by passing through the gastrosplenic ligament. The short gastric artery will also supply the posterior surface of the stomach, including the fundus. So this is regarding the peritoneal fold question which was asked. Then the next question was from histology. Surprisingly, most of you said there were like two questions from histology. Both of them were like not that difficult. Okay, so first question was an image based question, as most of the students have sent the questions. So it was, which structure is responsible for changes observed in the marked area? And it seems this was the marked area. Now what is this area? Remember, this area is the uterine glands. Okay, now how do you come to a conclusion that this is uterus? So if you just observe the options, right? Now these are the structural part of an oocyte, right? So let it be theca interna or externa, granulosa or corpus luteum. All these are concerned with oogenesis. Now remember, ovary simply has a cortex and medulla, and if it has to be ovary, you would have seen lot of follicles. Primary, primordial, secondary, tertiary, corpus luteum, corpus albicans, all of that. But what you see here are plenty of glands, and these glands appear to be highly coiled, right? So this is basically the secretory phase, okay? Secretory phase of the endometrium. As we know, secretory phase is basically also referred to as the luteal phase of menstrual cycle, which occurs after ovulation, right? After ovulation, the secondary oocyte is released, the leftover follicular cells will form corpus luteum, and corpus luteum starts secreting progesterone, which will improve the complexity of the endometrial glands, right? This progesterone will prepare the endometrium by bringing about secretory change and increasing the thickness of the endometrium, and prepare the uterus to receive the fertilized oocyte. If fertilization does not occur, corpus luteum degenerates, there is withdrawal of progesterone, and then occurs withdrawal bleeding characterized by the next menstrual cycle, right? So the correct option here is corpus luteum, which secretes progesterone and is responsible for maintaining the luteal phase. Why it is not theca interna? Remember, theca interna secretes the sex steroids. Okay, now these sex steroids are converted into the androgens predominantly by the theca externa, right? So this is regarding one of the histology questions that was asked. Okay, done. Then granulosa cells provide structural support. Okay, then the next question was on the receptors of the skin. Okay, so the question, it seems, read like, which structure is involved in 2-point discrimination? And there were 4 important receptors which are present in dermis. Now let's see this. So when we take a look at the dermis contains Meissner corpuscles, then it contains Pacinian corpuscles, then it has free nerve endings, it has like Ruffini corpuscles. All these are present within the dermis. Right. So when we talk of the Merkel disc, these are important mechanoceptors. Okay. So these are mechanoceptors. When we talk about Pacinian corpuscles, remember P for P, it detects changes in pressure. Whereas free nerve endings are responsible for perceiving sensation of pain and temperature. Then Meissner corpuscles are responsible for fine or discriminative touch. Okay, so the correct option here again is the Meissner corpuscles, because these are responsible for carrying the sensation of fine touch, 2-point discrimination, or the discriminative touch. Okay, so this is regarding the receptors of the skin which was asked in your exam. So most of you have sent these questions consistently, so I have decided to discuss these. Right now, couple of students also suggested that there was a radiological image which showed possibly a picture of angiogram asking about the blood vessel. Abhishek sir has discussed it already, so please take a look at the radiology video to know more about it. And there was possibly one more question which was related to the obstetric conjugates, right? The conjugates or the pelvic diameters. Sonal ma'am has covered this in her video, so please take a look. Right? So these were some of the questions which we could receive from the students who had attempted it, and these were the questions which were like suggested by most students as the ones that were actually asked. Right? So this is regarding the anatomy questions which were asked in your INI-CET. Do let us know in the comment section how many of these actually came and how many of these you got it correct. All the best for your INI-CET results. Thank you.